Hi, everybody. Welcome to the informational sessions, Health Coverage Programs and Eligibility. My name is Karina Gomez, and I'll be presenting today. This is our agenda for this presentation. We'll be discussing who are we as a department, the programs we assist with, the enrollment times as well. We are the Health Coverage Enrollment Center. We help our residents find and sign up for health insurance. We are a part of the Boulder County Department of Human Services, and our services are free, unbiased, and 100% confidential. The programs that we help with and assist with are Connect for Health Colorado, Health First Colorado, also known as Medicaid, Child Health Plan Plus, also known as CHP Plus. Medicaid is a federal and state program that helps people with low incomes get free or low-cost health care. The coverage and services under Medicaid are doctor visits, inpatient and outpatient hospital cares, behavioral health, dental services, prescriptions, and medical transportation. There are many other services that are covered under Medicaid. For that, you can go onto the PEAK website, you can schedule an appointment with us, or give the Medicaid department a call directly. And I will have all of our information at the end of the PowerPoint, so you guys can note them down if you have additional questions. The eligibility for Health First Colorado you must be a Colorado resident, who are U.S. citizens or eligible immigrants and meet the income limits, which is very important. The coverage is available for children under 19, pregnant people, adults aged 19 to 64. And then we have some examples of the monthly gross income. So the gross income before taxes and deductions are taken out of that paycheck. For a household size of one, the amount is $1,769. For a household size of four, so for a family of four, the income limit is $3,658. As you can see above, the children under 19 and pregnant people have asterisks on them. So the income is higher for children and pregnant women compared to the adults from 19 to 64. CHP Plus is a low-cost health and dental insurance for children 18 and under and pregnant people in Colorado. It's for families who earn too much for Medicaid but need help paying for insurance. The coverage and services for CHP Plus and Medicaid are very similar. So there's covered doctor visits, hospital care, mental health services, dental care, prescriptions, and medical transportation, and many more. Unlike Medicaid, there are co-pays with different services with CHP Plus. And if you're pregnant, there are no co-pays. The eligibility for CHP Plus are for Colorado residents who are U.S. citizens or eligible immigrants and must meet the income limits. Children must be 18 years or younger, and pregnant people can be any age. Applicants must be uninsured and must not be eligible for the actual Medicaid benefits. The monthly gross income before taxes and deductions are much higher compared to Medicaid. So for a household size of one, the income limits range from $1,890 to $3,458. The household size of four, so family of four, the income ranges from $3,906 to $7,150. The other program that we help apply or assist with in applying for is Connect for Health Colorado. So Colorado's official health insurance marketplace where residents can buy private health insurance. It's the only place to get a federal financial assistance to help lower costs like your monthly cost for that health insurance plan. We have a screenshot or a picture here of the website, the official website for Connect for Health Colorado. The webpage is www.connectforhealthco.com. And we have this because we've worked with many clients who state that they've gone on to Google or just online and search like private health plans to purchase, and they've put in their first, last name, phone number, and then they've gotten 50 to 100 calls a day, regarding health insurance. But this is the official actual web page. There's no other one. This is what it looks like. If you have any questions, please always reach out to us, or reach out directly to Connect for Health Colorado. But this is what it looks like. So the eligibility for Connect for Health Colorado is you must live in Colorado and you must be a U.S. citizen, U.S. national or lawful permanent immigrant, and you cannot be currently incarcerated. And then the eligibility is based on income, usually for people earning up to about 400% of the federal poverty level. And on the next slide, I'll go ahead and I'll show the chart of that income. So it's going to look like a lot of numbers on here, which it is, but I'll go ahead and explain a little bit. And our team can also help you find financial help to lower your cost and see if you qualify. So since we've been using the example of one family member, family size hold of one, so the income to be able to get financial assistance or premium tax credit, your income must be starting at $15,650 and go all the way to $62,600 to receive that financial assistance. As you can see on the 400% and above, so 62,601, anything after that, you will not be eligible for a premium tax credit or any assistance. For a family size of 4, the income starts at $32,150, and it goes all the way to $128,600, and that this is your annual income for a family size of 4. Anything after that, you're not eligible for premium tax credits when it comes to any plans to Connect for Health Colorado. The coverage and services, all marketplace plans must cover essential health benefits, which include emergency care, hospital visits, mental health services, pregnancy and newborn care, prescriptions, lab tests, and free preventative services. There are many other services covered. You can always, again, kind of schedule an appointment with us or check online to see what those other benefits are, or if you have a specific service or benefit that you need to check to see if it's covered, please reach out to us. We'd be more than happy to assist you and see if that is covered. One of the most important things through Connect for Health Colorado are the enrollment times. So open enrollment, it starts November 1st, and this year they've changed it and it goes through December 31st. In previous years, it's been from November 1st to January 15th, but starting this year, 2026, to go into year 2027, it starts November 1st and it goes through December 31st. It is very important to, if you're planning to get health coverage for 2027, to go in, apply, submit an application, and see what your results are. If you are purchasing a plan, but it has to be done from November 1st through December 31st. After December 31st, you will have the special enrollment period, which you'll need a life-changing event. And what that is, it's if you recently were married, or there is divorce, a death in the family, like your immediate family, also like adoption, or if you move to the state of Colorado, that opens up the portal like for a special enrollment period. But you will need a life-changing event for that special enrollment period after December 31st. There is also the tax time enrollment. And what that is when you're filing your taxes, your federal taxes, they and state taxes, it will state on when you're going through it, it will say, are you interested in health coverage? through Connect for Health Colorado. You'll check mark it and say yes. After that, Connect for Health Colorado will be sending you a letter in the mail stating that you are eligible to go in and purchase a plan through Connect for Health Colorado. So that is what we call the text time enrollment period. So these are the health insurances companies that you will see through the marketplace. So it's Cigna, Rocky Mountain Health Plans, Select Health, Anthem, Kaiser Permanente, and Elevate Health Plans. So once you get your results, these are the companies that you will be seeing on there and that offer their their plans for you through the marketplace. Other health coverage options are discounted health coverage at your clinic. And for that, you would have to apply at your local clinics and reach out to them to see what the requirements are. And then there's also the hospital discounted care. So you will have to apply directly to the hospital um, with that hospital. So if you had any like a emergency visit to the emergency room, you'll just have to reach out to them and see if you do qualify for that discounted care program. These other three options on here, so these, if somebody is not eligible for any of the other three, so Medicaid, CHP Plus, or Connect for Health Colorado, due to immigration status, there's the emergency Medicaid, and you can visit colorado.gov/peak website to get more information or reach out to us. There's Omni Salud. You can call Colorado Connect directly for that information, for more information. And then Kaiser Permanente Community Health Coverage Programs, which is also known as the Bridge Program, that is completely different from us or anything that we assist with. So you will have to give them a call to get additional information. To schedule an appointment with us, you would have to give us a call. You can email us. So you can call us at 303-441-4530. You can email us at healthcoverage@bouldercounty.gov, or you can visit our webpage and schedule an appointment at boco.org/healthcoverage. And we have a screenshot of what our webpage looks like. So you'll just go in and click schedule an appointment in English. You'll get the next page, and it's going to be a calendar. You'll be able to select any of those dates that work for you, and then it'll show you the dates that are available for appointments. There are 3 of us, and during open enrollment, there'll be 4 of us assisters that you can schedule an appointment with. So if you are thinking to schedule an appointment with somebody specifically, you'll go ahead and just do the drop down and select that health coverage guide. Or if you just want to do whoever is first and whatever available first appointment is available, you'll just skip and you'll put anybody on there. Perfect. And then you can also apply on your own and enroll. So you can visit Connect for Health Colorado. You can visit www.connectforhealthco.com. Or if it's Medicaid, you can go to colorado.gov/peak. You can also call for assistance and have, either Connect for Health Colorado or the Health First Colorado Medicaid department help you enroll with that. So you would be calling for Connect for Health Colorado 855-873-6166. And for the Medicaid department, you will actually be calling the state and they can help you submit an application. That phone number is 800-221-3943. If you have any additional questions, any concerns, or something that you would like us to touch base in and go more into detail regarding any of the programs that we assist with, or would like to schedule an appointment, you can always reach us at 303-441-4530, and you'll get the prompt to leave a voicemail. So please just go ahead and leave us a voicemail with your first, last name, phone number to call you back at, and the reasoning for your call if you'd like an appointment or have a question. Um, we'll give you a call typically within 1 to 2 business days. Again, if you have any other questions, you can email us or you can just go on our webpage and schedule an appointment. Perfect. Again, if you have any questions, please don't hesitate to reach out to us. And thank you so much. I hope you have a wonderful day.